Changes on the way for California's pandemic response. A portion of vaccine doses will now be dedicated to the state's most vulnerable neighborhoods. News Channel 3's Danny Romero has more on which communities will be prioritized and how it's going to work.
Juan Rodriguez is relieved to finally be getting his COVID-19 shot.
It feels good. I mean, I'm happy to get it. I was kind of nervous a little bit, but I'm excited to now that mostly everybody's able to get it now.
We have to be bolder and we have to go bigger.
In an effort to make distribution more equitable, the state is now setting aside 40% of their vaccines for people who have been hit the hardest by the pandemic.
And let me be more precise, that disproportionately has fallen on the Latino community in the state of California.
Newsom's goal is to get 2 million people vaccinated in vulnerable communities where there are so many people of color and essential workers.
We have 35% in that lowest quartile when the state looks at it. So hypothetically, we should get more.
The county has targeted areas including Desert Hot Springs, North Palm Springs, parts of Indio, Thermal, Mecca, Coachella, and the Salton Sea. Riverside County's Assistant Director of Public Health, Michael Osher, says it's unclear how much more vaccine will be allocated to the county and when.
We're hoping it would increase substantially the number of vaccines we're getting, because we have been targeting those areas with our mobile teams for quite some time. And we started with 2 mobile teams. Now we have 5 mobile teams.
In Riverside County, they've ramped up their efforts to vaccinate communities of color compared to the state. 21% of the Hispanic community has been vaccinated, shown as the gold line on this graph.
Our vaccination in those lowest quartiles is not where we want it to be, but it's better than the state and better than it was 3 weeks ago.
In Indio, Danny Romero, News Channel 3.